An Indianapolis woman came to the Bay Area for a vacation with her husband to watch some car races at the Showtime Speedway. After she got home, Carol Martin realized that she had a nasty infection. That was 2 months ago. She had 2 major surgeries and spent 2 weeks in the ICU. The 50-year-old went home from the hospital, but soon after, she died. Now the medical examiner is trying to figure out if a flesh-eating bacteria led to her death. The couple's children set up a GoFundMe account back in March to help cover her medical expenses. They didn't have health insurance. Now those donations are going to help pay for her funeral. Again, Carol Martin's death has not officially been ruled the result of a flesh-eating bacteria yet. Her husband says the only body of water that she went in was a hot tub. 10 News' Candace Avila spoke to a pool cleaning specialist about the best ways to protect yourself.
It would be the water chemistry not being properly set, and that's the #1 thing. I mean, what you can't see is the scary stuff about pools.
Like bacteria, especially in hot tubs.
Yeah, they're a smaller body of water. Also, they're heated up to, over 100 degrees, so it really allows that bacteria to grow really quickly.
Pool maintenance expert Greg Agerskoff says first scan the tub for any red flags.
Cloudiness, or if you see it green, I would stay away from it. Wouldn't even touch it. And yeah, you can get bacteria from pools if they have not been regularly, maintained.
He says most high-end hotels are checked numerous times by the health department, while smaller chains may not be checked as often. If you're worried, you could get a water test like this one.
A lot of people, what they don't do is empty out their spas on a regular basis. They'll keep that water in there year-round, and even though you're chemically setting it, the water has been done. It needs to be changed out.
When it comes to flesh-eating bacteria called necrotizing fasciitis, the CDC says about 1,200 cases happen each year, and that the bacteria does not spread from person to person. The most common way of getting it is when the bacteria enters the body through a break in the skin, like a cut, scrape, burn, bite, or more.
Well, especially a spa. I would not get into a spa with an open wound.
The CDC says the best way to protect yourself is keep your immune system strong, practice good hygiene, and proper wound care. As for how often it happens in the Tampa Bay area, one doctor says,
I have seen a case, but it's rare, especially in children. The children are generally healthy, but it can occur in a previously healthy person.
Candace Avila, 10 News.
This is something that is easily confused with other injuries like a pulled muscle, but keep an eye for how quickly the painful area spreads. If you think you have it, you need to go to the ER and get tested for bacteria immediately.